G'day and welcome everybody. If we do have a couple of early arrivers, we will be kicking off soon. Just seeing some people filter in now. Hello, John. Hello, Karen. Pleasure to see you all. We'll be kicking off in about 60 seconds and we'll be back with you then. Just continuing to wait for some arrivals here. If you do want to utilize the chat bar or the Q&A bar, I'll touch on these again later, but if you do want to post a message in there or post an early question, I'm sure we'll cover a lot of that content as we go, but if you do have an early question, feel free to utilize those two bars. Otherwise, we'll give it, I would say, about another 45 seconds, and then we'll kick off. This is the longest we've gone without speaking to each other for a couple of weeks, Dish, I think.
It is, absolutely.
Okay. Unless otherwise informed, I think we're good to go. So I will kick things off. Welcome everybody to today's webinar. The topic of today's webinar is patient retention mastery through the eyes of the dentist. So today's webinar is going to take the form of a conversation between myself and Dr. Dish, who we are very lucky to have with us and very thankful to have with us to share his experience. G'day, Dr. Dish. How are you going?
Good, Josh. No, thank you. Thank you for having me. I'm super excited to talk about retention today.
Awesome. Well, just before we get into it, and I'll allow you to introduce yourself in a little bit more depth soon, just a couple of housekeeping details. I have touched on these already a little bit if you were early into the webinar. We do have a chat bar there, so feel free to chat back and forth. I've got a lovely hello there from one of our guests. Hello to you too, Heliana. And we've also got a Q&A box. So if you have to choose between one, maybe focus on the Q&A box. If you do have any questions that you'd like to have covered throughout the webinar, most likely at the end of the webinar, we'll get to those. Hello, Amia. Please drop them in the Q&A box. They won't be ignored. We'll either get to them today if we have time, or we'll loop back on those personally for you. The last thing is we will be sharing a recording of the webinar in the coming days, most likely tomorrow. You'll get that if you do want to review anything that we discussed today. And also we'll be sharing some details on how to get in touch either with Centaur or with Dr. Dish following this. So that will come at the end of the webinar as well. So if you are keen to learn more, please hang on until that stage and we'll share those details as we get there. To the webinar itself. So obviously today we're talking about patient retention mastery. Our goal is definitely not just to talk about the concept of patient retention, but to give you some actionable strategies that you can take away. So a quick run through of what or how we're going to approach that. Firstly, we're going to talk about 3 fundamentals to a successful dental practice, and then we're going to zoom in on patient retention and why it's crucial. We'll discuss a little bit about, hey, what do things look like now in a lot of practices? What's the impact of having no system on your practice? And then we'll get into the meat and bones of it. So we'll start to talk about what these actual strategies are that we've seen work, and particularly Dr. Dish has seen be successful out in the real world. We'll wrap up there on some of the benefits that we should see from those strategies, and then we'll get to that find out more in Q&A section that I've just mentioned now. Now, about me, if anyone's wondering who my name is, not my name, but who I am, my name is Josh Gerrard. I'm the National Inside Sales Leader at Centaur. I've been here almost going on 2 years now, so time flies. Prior to that, I do come from a software background rather than a dental background. But a lot of those years in software have been spent specifically working with businesses, almost in the consultancy role, a lot of those discussing How do we activate customers, or in our case, in the dental world, patients? How do we engage and activate those? So I'm here today to, I suppose, facilitate and allow Dr. Dish to share his experience, and maybe I'll pop in with a question here or there as well. Dr. Dish, you're the star of the show. Do you want to give us a bit of an intro into yourself?
Yeah, love to, Josh. So I guess my story started in 2018 when I graduated as a dentist from the University of Otago, which is in New Zealand, for anyone who doesn't know. My first few months as a dentist was not typical for a new grad. Within 3 months of graduating, I jumped straight into practice ownership. So at the age of 23, I had already bought my first practice. And ever since then, it has been an absolute roller coaster ride of ups and downs. But I just loved facing the challenges of not only learning, the clinical dentistry, but also learning everything that there is to know about managing a clinic and managing its people. But, with a lot of love and support from friends and colleagues, and most importantly, my family, over the last couple of years, we've been able to take over 2 clinics and really, really scale them and make them from an average clinic with average returns to really awesome clinics with high profits, really awesome cultures, and most importantly, really good relationships with our patients. So I'll keep it brief, but just to name a few things, we were able to, in a very short amount of time, take our Google reviews from about 40 Google reviews to nearly 200 Google reviews. We were able to triple the number of new patients coming into the clinic. We were getting about 50 or so per month, and now we're getting consistently more than 150 per month. And we were also able to significantly increase our conversion rates and our recall rates, getting people to say yes to what we offer and making sure that they come back to see us again and again. And doing all of this helped us, double the revenue, more than double the revenue of our clinics, and fill a whole bunch of empty chairs. So I'm really excited to, share some of the strategies with everyone here today. And, these strategies is what helped me achieve these, goals in such a short period of time.
I think we're really excited to hear them, Dr. Dish, and good to hear, I suppose, that Kiwi accent didn't creep in over the years at the University of Otago there. So let's jump in. I suppose as an overview, those 3 fundamentals to a successful dental practice that you mentioned. Do you want to take us through? I think there's 3 key dot points here that you want to take us through that you see as those key building blocks to being successful.
Yeah, absolutely. Before we get into the nitty-gritty of everything, these are the foundations, the foundational building blocks. The first foundational building block of a successful practice is an incredible marketing strategy. Right. So this includes things like your brand image. It includes your social media. It includes your website and your search engine optimization. And it also includes things like any Google ads that you might be running or any social media ads that you might be running. So what's important is that clinic owners are going through this list and checking all of these things off, because it is these marketing strategies that bring new patients in through the door every single day. Now, the second fundamental here, Josh, is a fantastic service. So the service that you provide for your patients has to be so amazing that you get people to say yes to what you offer, and you want to make sure that they actually remember you, right? So the way that I like to think about an amazing service is in terms of the patient journey. Right. As patients move through an experience with your dental clinic, they have several different touch points. So this can range from the first impression of your website to the phone call to when they are welcomed into the clinic, all the way to how you follow up with them after the appointment. Right. So clinics need to make sure that at each and every one of these checkpoints, you're providing that amazing service and an unforgettable experience. Now, the third and final fundamental building block is an amazing retention system, which just so happens to be the topic of this webinar, which is super cool. So retention is very, very important, because what's the point of getting all of these new patients in and providing them with such an amazing service if no one actually stays long-term, right? So we need to make sure that we have retention systems and retention strategies in place so that our patient base isn't leaking.
Fantastic. Well, let's jump in then, I suppose. I think one of the reasons we chose, or correct me if I'm wrong, Dr. Dish, but one of the reasons we chose number 3 to focus on today and patient retention today is, in my experience, and this is across different industries, so please enlighten me on dental, but I tend to see a lot of focus placed on 1 and 2, right? A lot of people back themselves, hey, I can deliver a fantastic service. This is what I do. And number 1 is one of the first things they do when they start their business or their practice is to sit down and come up with a marketing strategy to get people through the door. Do you see as much focus placed on that patient retention piece in the dental space? Or is it like in my experience with other industries where, the percentage of people doing number 1 is 80%, percentage of people doing number 2 is 70%, and then there's a big drop off to the percentage of people who are actually tracking their retention?
Yeah, no, Josh, you're on the money. You're absolutely right. What we tend to see in the dental industry is that everyone is pouring money into trying to get new patients all the time. And we really do need to remember that, there's several other indicators of a growing practice and a successful practice, and we can't only focus on the new patient numbers, and we need to focus on keeping what we actually get. So focusing on that number 3 and the retention of it.
Interesting. So patient retention, why is it crucial? I think, and sorry to kind of put you on the spot with this, but before we look at why this is so important, can you define for us what you mean by patient retention? I feel like it might mean different things to different people. What do you define as patient retention?
Yeah, so look, through the eyes of a dentist, in simple terms, for me as an owner, I would say that patient retention means that patients that come to your dental clinic want to stay with your dental clinic. It's as simple as that. We put all this effort into getting people in, and we just want to make sure that all the people that come to us would like to stay with us long term.
Okay. Easy, nice and simple.
Yeah.
So tell me, Dr. Dish, we know what patient retention is. Why does it matter? Why do I care as a practice owner?
Yeah. So I think one of the fundamentals to understanding why patient retention is so crucial is, well, first we have to understand how valuable actually is a single patient, right? So there's an easy way to answer this, and it can be answered by using a metric called the LTV, or the lifetime value of a patient. So the LTV is, I guess, the total revenue that the dental practice can hope to gain from a single patient over the period of time that the patient stays with your clinic. Now, the reason LTV is vital is because it helps us to understand, I guess, long-term financial impacts of retaining your patients. So for anyone who doesn't know how to calculate the lifetime value, what you first need to find out is the average expenditure of a patient over, say, a 1-year period. And then you multiply that value by the average number of years a patient stays with your clinic. So as an example, you could say, or you might find that an average patient over a year spends, say, $1,000 with your clinic. And that average person stays 3 years with your clinic. So 1,000 times 3 is 3,000 as your LTV. Now, this really beautifully leads into the second point here, Josh, that when you realize that an average value of a patient or lifetime value is $3,000, you realize that you're sitting on a gold mine, right? Because what you might be seeing is that your patients are spending, $100 here and $100 there, and then you don't see them again. But in reality, they should be spending over a period of time 10 times that amount with you, right? So most practices are, they have so much untapped value sitting in their database with scores of patients that haven't been recalled properly. They haven't been retained properly, and even or reactivated properly. And the worst one is when they've just been lost in the system and they've been forgotten. And I think this really leads on nicely to the third point, which is the leaky bucket metaphor. I'm sure that a lot of you have heard of this leaky bucket metaphor before, but if we imagine our patient base as water in a bucket, most owners, as we were discussing, focusing on the fundamentals 1 and 2, most owners are frantically pouring more and more water into their bucket without realizing that there's big fat holes at the bottom of their bucket. And they're actually losing more, they're losing just as many patients as they're trying to get in. So there's not actually much net growth.
I think it helps as well that leaky bucket is definitely a metaphor that I think a lot of people have heard. It doesn't mean it's any less true. But that water costs money as well. You know, we talked about that marketing budget and what we're applying in there. If you're paying a lot for that water, it seems a waste to have it leaking out the bottom. Okay,
Absolutely.
so that makes sense, Dr. Dish. Hypothetically, I'm a practice owner, and at the moment, now this is very hypothetical. I don't have the skills to do that, but at the moment, I don't have a strategy in place at all. Things got busy. I got set up. I had all of these new patients coming in, and it kind of fell to the bottom of the list of things that I wanted to set up. It's on the bottom of my to-do list every time. I rewrite it every time. What are some of the negative impacts or the detrimental impacts that I might be able to recognize, or that maybe I can't recognize them, that are actually occurring within my practice?
Yeah, absolutely. So Josh, there's so many detrimental impacts when you don't have a solid retention system in place. One of the first ones is you have really high rates of patient attrition. This means that, as we said before, patients are just leaking out of your clinic from the back end. Right? We work incredibly hard and spend so much money and time and effort to get all these new patients in. But if you have high rates of patient attrition, it means that all your time and effort is just being wasted. And when it's being wasted, it means that owners are constantly having to fight with all the other clinics to constantly acquire new patients every single day just to keep afloat. And another really important thing about patient attrition is that clinics need to be measuring this, right? Because if you're not measuring your patient attrition, then you could be under the false pretense that your clinic is growing. You know, you might find that in 1 month you had 10 new patients, then you had 20, and then you had 30. So you think, I'm doing well, my clinic is growing. But when you don't know that you're losing 50 patients every month from the back end, then you're not actually growing, you're stagnating and decreasing in size. So that's one of the big detrimental, factors. The next factor, which is another terrible thing, is a breakdown of trust and, loss of relationships with your patients. One of my favorite quotes is that consistency creates comfort. So it's really important for patients to have regular appointments with their dentist. And it's also important for there to be consistency in terms of the dentist that the patient is actually seeing. Because when a patient has a regular dentist, it helps them form a connection with them. And that connection in turn helps to build long-lasting relationships. And without long-lasting relationships, there's no trust. And if there's no trust, that means that there's a much lower rate of treatment plan acceptance. So we really need to make sure that we have that relationship with our patients. Now, as I'm sure you'll all agree, when you've got high rates of patient attrition and a breakdown in the relationship and the trust, it leads to decreased revenue, right? Now, practices have several revenue streams, but a major revenue stream comes from these recall patients, right? These are the patients that are coming back to you every single year and multiple times a year. And it's this revenue stream from the recall patients that actually helps stabilize your cash flow during uncertain times. But if you don't have any systems in place to keep it consistent, then you're going to lose it. And you're not only going to lose the revenue from the recall itself, but you're also going to lose the revenue that arises from the ongoing required care, right? Or you're going to lose the chance to diagnose additional care that they need and all the revenue that's associated with that. And Josh, I think the final point that I want to mention, it's not only about numbers and it's not only about money. What happens when you're not retaining your patients is that it leads to a detrimental outcome for your actual patient's health, right? We have to remember that it's a person on the other end of that appointment, and that person needs our help to stay healthy, right? And dentistry is one of those things, it needs to be regularly maintained. And if your patients aren't coming in regularly, it means that disease is allowed to grow and their dental health is worse off.
Yeah, that's really interesting. I think, perhaps putting on a hat that I'm more suited to wearing, which is the patient's hat rather than the practice owner's hat. I will put my hands up and own up to the fact that I have changed dentists a few times over the years. And I guess hopefully they're not on this call and they don't recognize me, but it's not just that next appointment that they've lost, or it's not just the next 2, 3, 4, 5 appointments that they've lost. It's the opportunity for me to refer my friends. It's opportunities for me to leave reviews online, all of that kind of stuff, which builds up. So it's not just that immediate impact. If I hear what you're saying correctly, it can be, you know, years of lost revenue down the line.
Absolutely. It's a domino effect. You know, the patient is not just a patient in itself. You know, that patient has a family. Usually when new patients come in and they like the experience, they bring their family along. And then they might, you know, bring their spouse and their kids, and they'll refer their friends and their neighbors. So you really need to put in that effort into retaining every single patient, because it's just a flow of more new patients every single time we perform.
Not to mention the detrimental impact on my own dental health, which we won't get into today. Okay, Dr. Ditch, we've talked through, you know, some things about why this is important and perhaps what we're seeing if we're not executing on it in the way that we feel we should be. Let's get into some things that I can do, some things that I can take away. What are your key or your main suggestions today for strategies for patient retention that I could actually take away and implement?
Yeah, so that's what I wanted, I guess, the objective of today to be. I wanted to give everyone, you know, some points that they can literally talk to their, you know, their managers and their teams today and implement straight away. So the first one that I want to discuss is something that we call the 4-2-2 rule. So the 4-2-2 rule is a framework which guides us as to when we should be sending our reminder messages to patients. Now, this framework is research-based, right? We haven't pulled these numbers out of thin air. These numbers have been shown to be the most effective. So the 4 stands for 4 weeks. This is the first message that we send to a patient 4 weeks before their 6-monthly appointment. And this message serves as an initial reminder for the patient. Now, the 2 stands for 2 weeks. Okay, this is pretty much a second reminder that you send to the patient 2 weeks before their 6-monthly appointment. Now, the 2 weeks one is important because if the patient has any reservations as to whether or not they're going to be showing up for their appointment, this is when they must tell you. And it's important they tell you now, because in 2 weeks, it gives you enough time to refill that slot if the patient can't make it. Now, the final 2 is 2 days. Okay, this is the last reminder that you send, and it effectively serves as a confirmation text for the patient to lock in their appointment. Now, it's worth mentioning as well that, you know, everything I'm saying you need to take with a pinch of salt, because every clinic is different, every area is different, every demographic is different. So you will need to test this out in your own clinic and trial out a few different strategies and figure out what works best for you. I've found personally that 4-2-2 works best for me, but you know, someone else might need to do 3-2-2, or someone else might need to do 3-1 or 3-1-1. So whatever works best. Now,
so the focus there, I suppose, on having a strategy rather than having no strategy, and trusting it to chance, I suppose.
Absolutely, yeah. We need to be doing something to make sure, you know, that we're moving forward. If we're not doing anything, then how do we know what's working and how do we know what's not working?
Cool.
Now, number 2, and this leads on really nicely from point number 1, is we have to have multiple channels of communication. So we can agree that we do definitely need to consistently remind patients, whether it's 2 or 3 reminders. But what's key here is that when we're reminding the patients, we shouldn't just use one channel of communication, right? So the main ones we have are email, phone, and text. So when you're sending these reminders 4 weeks prior, 2 weeks prior, 2 days prior, it's effective not just to send 3 text messages or 3 emails or 3 calls. It's shown to be up to 85% more effective when you mix and match the communication channels that you're using. So an example of what you could do and what I do is that 4 weeks prior to their appointment, I send an email to remind them that they've got their appointment coming up next month. Then 2 weeks prior, instead of an email, I call them. And then 2 days prior, we use a text message. So mixing and matching and using, different fronts helps, stick in the patient's mind that they've got something to do. Now, the third point, Josh, I think this is something you can really expand on in terms of taking advantage of, the software's automatic recall system.
Yeah, if I could I suppose I'll put my centaur hat on for a little bit, although I don't think it's, it should be called out. It's not Dental for Windows specific. I wouldn't say, although obviously I have the most experience there. The things you're talking about, Dish, I suppose if we want to categorize them under a recall system and a way to make sure we're constantly reaching out or strategically reaching out to engage with our patients and get them back in for that next appointment. Those are things that you should be having a conversation with your software provider, whoever it is, to figure out how to put in place, and ideally put in place automatically. So to utilize automation to do that. This is something, if this is a shocker to you, this is something, speaking from Dental for Windows, that you should have available with us, and with any other system as well, as it does really form the backbone of, hey, how are we going to get those patients back in? And if you are doing this manually, I would say, in terms of something to take away, that this is a major opportunity to save some time and save some money on how you do that. Dish, I know you have this set up. Do you want to take us through, I don't want to say how yours works. Do you want to take us through how your system works at the moment?
Yeah. So I think one of the biggest barriers that people have to setting up something like this, or even having a recall system like this, is because they think that it's too much work. And I, at the start, had, I used to think something similar. But as you're saying, Josh, and nowadays everything is about automation, right? So we want to get to a stage where these messages are automatically being sent out, and I can sleep well knowing that every single patient is being properly recalled, and there's the highest chance that they're going to be retained. I don't want to be having to tell someone to be sending out all these text messages, because as your patient base grows bigger and bigger, it's not feasible to be doing any of this manually. So it needs to be, set up properly, and it all needs to be automated, so you don't have to worry about it. People don't need to think that this is going to take too much time to set up, or it's going to take too much time to do, because it's not true. My system is set up in the 422 way. So every single patient, as they leave the clinic, an automatic pop-up comes up onto the screen, and they're put into the recall list. And as soon as they're in the recall list, they go through that 422 process. So I know that every single patient that walks out of my clinic that doesn't have an appointment in, a week or two, is going to go down that pipeline, and there's a higher chance that they're going to be coming back to see me again in 6 months.
Yeah, awesome. And that's a really excellent example, I suppose, of how our software, and how I assume your whatever practice management software you're using can be utilized to do that and put that in place. You mentioned if patients don't have bookings coming up in the next couple of weeks, but more generally speaking about pre-booking appointments, this is something that you implement in your practice?
Yeah, absolutely, Josh. I think that pre-booking appointments is something that's vital. We have a rule in our clinic, and that is that no patient leaves without an appointment, right? And in my head, there's only two scenarios. The first scenario is that the patient is booked in for their upcoming treatment appointment, whether it's a extraction, or whether it's a filling, or whether it's a crown or a root canal, or whatever it is that they need. That's scenario number one. And scenario number two is that they're booked in for their 6 monthly. There's only those two options. And when you have this rule in place, it just makes life a lot easier. It means that you're not worried about patients going up onto some list and then being forgotten. Every single patient that walks out is in the system, so they're not going to be lost. So I think it's vital for clinics who aren't. They need to now start adopting pre-booking every single appointment, and I guess encouraging the patient to know that something is booked in that they have to keep up with.
Do you get much pushback on that? I can't imagine myself saying no to a 6 monthly appointment. Given especially if I do have a good relationship. Did you get much pushback from that at the front desk or in the chair? Or?
Look, we get very little pushback. I can't say zero, because at the end of the day, you can't make everyone happy, and there's always going to be people who absolutely don't want to do it for whatever their personal reasons are. But it's all about creating a culture, right? And the culture isn't only about the culture you have with your team, but it's also about the culture that your practice has with the patients, right? So it's about, it's our job to educate the patients, to, I guess, show them the value in maintaining that 6 monthly appointment, and show them the health benefits that they get by maintaining their appointments. So you want to educate them to the point, and this is almost the point to we've got where we are now, is my patients don't get angry when we ask them or remind them for those appointments. It's actually the opposite. My patients get angry when they don't get their reminders. So when you have that relationship with the patient and you've built that trust with the patient and they, I guess, appreciate what you're providing them, then no, you're not going to get much pushback.
Awesome. Unintentionally, I think I've led us into our last point there in terms of turning that exceptional service that you provide into those real relationships. And you think that's vital?
Yeah, absolutely. In my opinion, the most vital thing that will take your retention rates to another level is by providing an amazing service and forming real relationships with your patients. Because you have to think of it at the end of the day, if you don't give your patients an unforgettable experience from the moment they call you to walking into the clinic to following up once they leave, and if you don't endeavor to truly connect with your patients, then they won't remember you. And no matter how many times you message them or call them, they won't want to come back because they don't have that connection with you. You have to remember that people do business with people that they feel comfortable with and people that they like and they trust. So if you don't, help to nurture that trust, then you're going to lose the patient either way. And I think this really comes down to remembering that dentistry is not just about your clinical skills. Obviously you do need to be doing good dentistry, otherwise there's no point. But it also comes down to your communication skills. How are you communicating with your patient? How are you making them feel comfortable with you? How are you connecting with your patient? So that's a vital aspect of a good retention.
On that note, we've talked a little bit about the patient journey. To me, it stands out, hey, the place that I can provide the most exceptional service as a dentist or as a practice owner is in the clinic, right? Like that's when I have control over things. Is there another point in that patient journey that you see as really crucial to building trust or building relationships beyond, hey, when we're actually face-to-face with people in the clinic?
Yeah, that's a really good point, Josh. I think that if we were to narrow it down into, one other time in the patient journey, I would say it would be after the patient actually leaves your clinic. I think that the duty of care of a dentist doesn't end once the patient just leaves. Part of the package of providing an exceptional service is actually taking care of the patient after they leave. Because what you have to remember is that, when you're with the patient, you're in total control. The patient is numb and there's often, not many things that can go wrong. However, once the patient leaves and the numbness wears off, the patient is scared, the patient is in pain. Sometimes they have questions that they didn't remember or they were nervous. There could be a myriad different things. So we really need to focus on how are we maintaining that relationship and connection with them after they leave, on the first few days after their appointment. And when you can show them that you're willing to, I guess, be in touch with them and follow up with them, and it really shows that you care, because you haven't just done the treatment and then, kicked them out the door and taken the money. You're actually following up with them and making sure that they are okay after the treatment that you've provided.
Not to, I suppose, to dig too deep on this one point, but that sounds like something that you've implemented in your successful practices, I suppose. Is it a manual process for you? I've mentioned automation before. Have you started manual and shifted more to automation? Is it text-based? How do you go about that?
Yeah. So look, it's been foundational in what has made my clinic so successful. We've always taken follow-up with our patients very, very seriously. At the start, you're right, Josh, it was all manual. I would have Veronica, my front desk coordinator, manually texting every single patient that we saw the next day or 2 days after, and following up with them to make sure that they are okay. But the issue that we had with that is, it took a very, very long time. It was error prone. It was very easy to make mistakes. And sometimes when you're messaging, 50 patients the next day, things get lost or things get confusing and you lose track. And that really begs the question as to, how can we make that process more effective? How can we make it more efficient? And how can we make it automated? And that's when I really started shifting into using software to do that. So I use Patient Care, which is a software that allows you to follow up with patients and make sure that they're okay after their appointment. It's beautifully integrated with your practice management software so that you don't have to text anyone. It all automatically goes out. And it not only allows you to check in on your patients and make sure that they're okay, but it also allows you to gather feedback from your patients to make sure that you're, providing the service that you think you're providing.
Yeah, fantastic. And look, I didn't intentionally lead you into that. I suppose it is a service, and it's something that we heard, right? We heard that feedback around, the importance of all the benefits of follow-up, and yours was one of the voices that we heard on that. So it is a solution that we offer. I think it's important to note, let's have a strategy for following up as the absolute base. If you do want to have a discussion with us about how we can help with that, please do. But I don't want that message to get lost in, our 5 key points here. And like, those real relationships are born of exceptional service. And if you find a strategy that works for you on that, that's the most important thing for us here.
Absolutely.
Awesome. So 5, as I mentioned, we do have a recording of this, and we'll get out a summary as well. And there's lots of different other ways to get in touch about those strategies. So don't worry if your notes are a little bit scrawled or if you haven't managed to get them all down. But Dr. Dish, you've experienced this. You've implemented those strategies. What were the effects for you, or what were the positive benefits of implementing those strategies that you've seen?
Yeah, so there's many positive benefits that come when everything is working like clockwork and all of your systems and your strategies are in place. So the first, I guess, benefit that we get is increased revenue. Right. This one is obvious. When you have high retention rates, it means that you have a lot of return customers. And these routine appointments not only allow you to collect the revenue from the hygiene appointment itself, but as discussed, you also have the chance to identify additional treatment needs and collect revenue from any other ongoing care or any other ongoing treatment. So that's a big one. Now, the second one is, decreased marketing costs. When your books are full with loyal patients, we don't need to spend crazy amounts of money on, fancy marketing things, marketing campaigns. And we don't need to spend money competing on Google with every single other dental clinic in the area to attract new patients. Making sure your retention is good is a very low cost and highly effective strategy when it comes to, marketing. And it's actually well known that it's actually 6 times cheaper to recall and reactivate a patient than it is to find a new patient. So that's a really important thing to remember. When people are focused so much on attracting new patients, it's so much cheaper when you've got your retention locked down. Now, we've talked about this one before, but we'll definitely mention it again. When your retention is good, you have increased trust and you have better relationships. So patients who have, I guess, established, a strong relationship with their dentists are more likely to trust their recommendations, right? And more likely to not only trust their recommendations, but accept their treatment plans. So this means that as dentists, we don't need to be too pushy, saying that, this is what needs to be done. We don't need to be too salesy. We need to honestly connect with our patients and tell them that, look, this is the best option for you. And because they trust you, they'll accept that option. But the thing to remember is that this trust and this relationship doesn't happen overnight. It takes many, many recall appointments to nurture and build that trust and prove to the patient that you know what you're talking about and you can actually provide what you're saying you can provide. And I guess the final, benefit is it allows you to act on delayed diagnosed treatment. So what I mean by this is that many, many patients tend to, I guess, delay treatment that's already been diagnosed. Someone knows that they have a root canal that needs to be done, or they know that they have a crown that needs to be done, but they procrastinate because the time's not right, or, they can't get enough time off work, or they haven't got enough money, or whatever the case is. But when you have consistent appointments and consistent conversations about, said issue, it's often all that it takes to get the patient to pull the trigger and get the treatment that they deserve. So these are, I think, in my opinion, the biggest benefits.
Awesome. And not insignificant benefits there either, I think it's fair to say. Well, firstly, thank you very much, Tish. Thank you, everybody, for your time. We do have a couple of slides to go, but now was the time that we set aside to answer some questions if we did have time, and it looks like we do. Before we get to that, you should see a poll pop up in the next 20 or 30 seconds ago. Just a simple question whether you'd like us or you'd like to know more from D4W, pardon me, around how we might be able to help with your patient retention. So please feel free to answer that. If you do have any more questions, please chuck them in the box. We'll go for as long as we can here and cover as many as we can get to. Dish, you're happy for me to kind of just throw some things at you here off the cuff, and you can see what
absolutely. Let's see what we can do.
Awesome. So the first question I have is from Carly, and this is specifically around I believe the 442 methodology that you have. And Carly asks, do you still send the last two messages if they confirm at the first point to avoid contacting too often?
Yeah, look, in my opinion, you still should. 4 weeks before an appointment is quite a long time. A lot of people are busy and a lot of people have so many things going on. You will get a small subset of patients that even tell you 6 months before that they're going to be at their appointment at a certain time and a certain date, and they show up without fail. But in most cases, people say yes, almost automatically at some point 4 weeks before. But when it comes closer and closer to the date, they might forget. But again, this is again about educating your patients and letting them know that, hey, look, you're going to get a few reminders. And just let them know, not to worry too much about it and just give us a quick yes, shoot us a quick message, just so we know and we can lock you in and we have that appointment available for you. You have to frame it in a way that you're doing this for them, not for us.
Fantastic. Thank you. I do have one here from Brianna, who's obviously on a similar train of thought that I was earlier. What do you do if a patient, what are your next action points if a patient absolutely refuses to pre-book? I suppose, no, I won't lead you into it. I'll allow you to answer.
Yeah. So look, as I said, you're definitely going to get a few people like this that, they only come to the dentist because they're terrified and they only come when they're in excruciating pain. And we have to remember that at the end of the day, we want to make our patients like us. So if they, are absolutely refusing to rebook, then you don't rebook them. But what you can do instead is you can let the patient know that you're going to be putting the patient onto a separate list. We can call it a recall list, or we can call it a follow-up list. And you can tell the patient that, hey, look, I'm not going to rebook you now as you requested, but if you don't mind, what I might do is in about 6 months' time, I'll give you a quick call just to check in with you and see if you wanted to book in then for your next, routine appointment. So just let them know that you'll contact them in 6 months' time or a year's time. And if they say no to that, then your hands are a little bit tied. You don't want to do anything that the patient explicitly asks you not to do.
Awesome. There are two here, or one actually, that I'll jump into just from Karen, Karen Middleton, who says, hi, can you explain how the email automation works at the 4-week mark? How do we send these and how is it set up? That might be one to take offline, I think, or maybe we can answer it in the chat there, just because that will result in me talking more, I think, and nobody wants that. And Shul asks, thanks for the great seminar, Josh and Dish. Much appreciated. That's okay. Is it possible to automate phone calls? Now, I have thoughts on this, but Dish, if those phone calls are a part of a strategy, how do you make that as easy as possible, I guess, if you can't automate them?
Yeah, look, I mean, you can't automate the phone call. So that's something that does have to be done manually. But I guess what can be automated is you can get a ready-made list of knowing exactly who you need to call and knowing exactly when you need to call them. So it just makes it as easy as possible. The phone call itself, for the sake of actually connecting with the patient and showing them that this clinic cares about you, needs to be done by someone.
Yeah, well, that's the exact answer I was gonna give. From my perspective, just on that, Anshul, I have seen a couple of different providers enter the market, not specifically dentistry, but elsewhere, that will do kind of automated AI-based phone calls. I think we're still largely in the early stages of that, but something potentially to keep an eye on as we go. Obviously, that would be a decision practice by practice, whether you want computers calling out for you. Maybe there's certain use cases where it'll work. Maybe for patient care, less so, but that is something that I have seen. So perhaps that's what you're driving at, but something to keep an eye out for in the future as well. Last couple here, we did. Oh, we're getting more and more as we go, but last couple of years, we talked, going back earlier in the presentation, Dish, we talked about the average lifetime value of a patient. You threw some numbers around there. Is that something that's standard, or can that vary practice to practice?
Yeah, look, absolutely. It varies a ton. As we all know, every practice is different, and the demographic and the socioeconomic status of every place is different. It also, the lifetime value of a patient, or the average spend value of a patient, differs depending on the type of work that the clinic is doing. The average value of a patient for a clinic who's doing high-end implants and aligners and cosmetic work is obviously going to be much higher than an emergency clinic, for example. So it varies a lot, but I guess if we were trying to give you a rough and dirty answer, what I most commonly see when I'm working with clinics is that an average patient spends anywhere between $400 to $600 a year with a clinic. And on average, they spend maybe 3 years with a clinic. So, you would times the 400 by 3, and you would get to 1,200. So that would be an average lifetime value of a patient.
Okay, just to jump on the back of that, Dish, as well, I think that question was from Karina. That is also a conversation that you can likely have with your software provider. There will, whether it's a kind of, depending on the solutions that you have in place, whether it's do you call it a rough and dirty number there? Whether it's a rough and dirty number that we can get to, or whether it's something much cleaner, there should be a way to, at the very least, approximate that using some of the data that you have in your practice management software at the moment.
Absolutely.
If you have sorry,
yeah,
Dish.
Yeah, I was just going to say that. Josh, I'm sure the Centaur team will easily be able to help, but we can get a very accurate number for every single clinic. And I think every single clinic needs to know what their average patient spend is, and they need to know what the average lifetime value is of a patient, because it serves as a foundation for which they can do other things. I mean, if you don't know how much an average patient is providing to your clinic, what's the baseline in terms of how much you want to spend? I mean, there's no point spending $1,000 to try and get a single new patient if that patient's only giving you 200.
Yeah, absolutely. And I guess we had a question from Megan as well, just around how can Dental for Windows help us with recording patient attrition? Very much the same answer there. That would be, I would reach out to your account manager, or reach out to us in the follow-ups if you'd like. If you want to have a conversation about that, we'll be able to dig down and help you nail that number. If we do have questions around other metrics, again, the same applies. At the very least, we'll get you a rough and dirty number, depending on what type of analytics you might have in place and things like that as well. We'll get closer and closer to a really clean number. But things like patient attrition, average customer lifetime value, stuff like that, we should be able to do pretty simply. Dr. Dish, question from Ishan here. Question in regards to addressing patients with a treatment plan who may not have booked. How do you handle that particular scenario? So I suppose this is outstanding treatment plans, or outstanding treatment on the plan.
Sorry, can you just say that question one more time? I missed it there.
Oh, pardon me. So this is from Ishan, and the question is, Dr. Dish, a question in regards to addressing patients with treatment plans who may not have actually booked in for the treatment. What is your strategy around, I suppose, getting those additional treatments on their plan booked in?
Right. So I think if I'm not too sure if I've actually understood that question properly, but is Ishan asking us if they've got treatment that needs to be done, but they haven't actually booked in for that treatment? Is that what Ishan is asking?
That is my understanding of it, yes.
Yeah. So again,
and we've got a correct from Ishan, so he's still listening and he's giving us a thumbs up.
Okay, perfect. So I guess that part is mainly about how you're communicating with the patient inside the room. If they again know that they need treatment done and they're not booking in to get that treatment done at that time, they're definitely going to be booked in 6 months in advance right? So even if they, disappear, at least you know that they're still going to go through the 422 system and they're going to get contacted 6 months in advance. So this comes back to, again, that people delay diagnosed treatment. They know that they need to get a root canal done, but they can't be bothered, or this is not right and that's not right. So even if they don't book in 2 weeks, they're going to get reminded in 6 months. And when they come in 6 months, you're going to have that conversation again. Now, the other thing that the clinic does, well, my clinics do at least, is in addition to that 6 monthly one that's going to 100% happen, they will go on to a follow-up list, because a lot of these patients tell you at the reception that, look, I need to go home and I need to check my schedule. And by the way, I have scripts for everything, because your receptionist needs to know exactly how to handle all of these objections. So the receptionist will tell the patient that, hey, look, I totally get that you need to check your schedule. Obviously we don't know what your calendar is going to look like 2 weeks from now, but if it's okay, what I'm going to do is I'm just going to pop you on the follow-up list. So in 2 weeks time, I'm going to give you a quick buzz and just kind of see where you're at with your calendar. And then maybe we can book something. And then using something like this, again, very seldom gets pushback. Every now and then you are going to be getting a little bit of pushback, but again, it's seldom when you have a good relationship with your patient.
Fantastic. Okay, we still have some questions flooding in. I think we are getting to the end of our allotted time, so I think we might call it there. Thank you, everyone who has replied to the poll. Don't worry if you did click no on the poll and didn't specifically request a follow-up, but you do have a question here. We absolutely will get to your questions. It's just in the interest of time that we're going to need to wrap up. So I'll end the poll. I'll leave the poll open if I can at this stage. And the last thing we'll cover off on, I suppose, is, look, there is a QR code on the screen. If you want to scan that, it will take you to a landing page that has a summary of today. It also has details on how to get in touch with Dr. Dish. And also, obviously, you can reach out to us at Centaur as well if you want to have more of a discussion about, hey, this sounds fantastic. How do I get it into my practice? I suppose that goes for myself or for us and Dr. Dish. So scan that QR code if you would like to jump onto that landing page. We've also posted it in the chat. If you just want to click and do it on your desktop, that's there as well. So just to reiterate, those are the means, I suppose, of getting in touch. I really apologize if we haven't got to your question, but we will follow up individually on those to get you the answers you need. And I suppose apart from that, I just really need to thank Dr. Dish, or thank our attendees, firstly, for your time. I think we thought we'd be a little bit quick today, Dish, and we've ended up going almost the full hour. So thank you for your attendance and your attention. And thank you very
everyone.
much, Dr. Dish, for your insights today. I think it's been really, really educational.
No, thank you for having me. And I hope that, I hope that everyone has gotten a few really practical takeaways that they can go away and start to implement, and more importantly, start to trial. Everything that works for me is not going to work for you. You're going to have to figure out what works best for you. So I hope that you guys, really input this straight away into your clinics and see some amazing results.
Awesome. Okay, well, thank you again, Dr. Dish. We're getting a lot of thank you messages coming in, so I'll assume those are directed at you and less so at myself. So I'll send those over to you afterwards. But again, thanks again, and thank you to everyone who's joined us. And that will do us for today. But again, you can expect a recording of today's webinar, and feel free to be in touch if you have any further questions that maybe didn't pop in your head today. Thank you very much, guys and girls.